Can no longer continue with its ban on indoor religious services. What's your reaction, thoughts to that, and the plan going forward?
Well, we put out a new plan going forward. We put out new guidelines a few days ago that will allow for that to be accommodated. We obviously are concerned about that decision. We're not surprised by it. Decision's consistent with the decision that came out of the state of New York. It's inconsistent with a previous Supreme Court decision, well defined by Justice Roberts in a 5-4 decision, but the court flipped. Elections have consequences. New Supreme Court justice, court flipped, so their attitudes flipped. Law didn't change. I think Justice Kagan's dissent is a masterclass. And I encourage anyone who cares about public health to take a look at her dissent and how detailed it was and how resonant it certainly was to me and to all the health officers, I believe, up and down the state of California. But it was caveat. The decision by the Supreme Court had a caveat on singing, and we thought that was wise and considerate. But we respect religious liberty. I have great respect. I went to Santa Clara University, just down the block, a Jesuit university, grew up in the church. I have deep reverence for the church. I just want to keep people safe, keep people healthy, and this state has really led in that respect, particularly in those environments. But the Supreme Court is the final word, and we will abide by it.
Chris Sanchez, NBC Bay Area. Piggybacking off the public education conversation, our counties are doing things differently. Our teachers' unions are asking for different things. Everybody seems to agree that it might be good to get teachers vaccinated to make them comfortable, to make families comfortable in going back to school. But counties are taking different approaches at the local level. Is there anything that you can do to standardize that response to the teachers and the teachers' unions about vaccination so that we can get our public school kids back in class? I speak to you as a public school parent.
That's exactly what the legislative package is all about. That's what the statewide plan was all about. That's what this $6.6 billion framework is all about. That's what we're negotiating specifically to create a baseline of standards, expectations, transparency on testing cadences, on appropriate levels of PPE, ventilation protocols, to the extent we'll provide flexibility in that space, on spacing protocols, providing flexibility in that space, on making sure we have a cadence of staff testing and when we can provide more ample and robust testing of our students, different testing modalities, be it PCR or antigen tests, pooled tests, genomics tests. We're trying to provide flexibility. We're also putting out 4.6 of the 6.6 for learning loss that will allow an extended school year, would allow extended school days, would allow for more intensive instruction, support for wellness, mental, not just physical health, provide that flexibility, but with a standard expectation that would allow for collective bargaining, will allow for localism, but at the same time set up expectations that our default and our priority is to get our kids safely back into school. And again, my humble position is consistent with the CDC's position, consistent with President Biden's position, that we can safely do that as many schools have safely reopened in the midst of this pandemic and went through this surge very effectively and safely. We can do that before every single person in that school is vaccinated. I would like every single person in that school vaccinated, absolutely. And that's why we've prioritized our teachers. And we want to provide as many vaccination opportunities we possibly can, of course. But as I noted, when you're receiving less than 600,000 first doses a week, and you start to do the math, if that's the prerequisite, then we need to be honest with people. Just be honest and let them know, parents, millions of us, myself included, that it's very unlikely that we'll be able to accomplish that very idealistic goal before the end of the school year because of the scarcity of supply in vaccinations unless we took them away from the vast majority of others, our seniors and our most medically vulnerable. And that's the unfortunate position we're all in.
Hi, Governor. Stephanie Sierra with KGO. It's great to see these mass vaccination sites launching across the state, but top epidemiologists and health experts across the state criticize this should have happened months ago when we knew the vaccine was coming. It's been almost 2 months to date, as you know, since Pfizer's vaccine was approved for emergency use. So my question is, why did it take this long? And if you had to do it all over again, what would you do differently?
Well, the vast majority of vaccinations are not done in sites like this. The overwhelming majority of the vaccinations are distributed thousands and thousands of smaller providers in very culturally competent settings and communities. Very similar. For example, these are not the sites you'll see operationalized when we distribute some 19 million flu shots, which we do on an annual basis. And so building a system like this gives people a false sense of what you're doing. This is additive. This is important. This provides throughput. This is very symbolic and substantive, but it's not exclusive. Now, this site is a new site, and we're very, very proud of this site and very, very thankful to the leadership here in Santa Clara. But there are many other sites that were up a couple months ago. I was down in San Diego at one of those large-scale sites at Petco Park. Dodgers, a few weeks back. You'll see large sites like Cal Expo up in Sacramento over a month and a half ago, organized and planned. But again, the backbone of this distribution strategy are thousands and thousands of local providers, including now pharmacies themselves, community health organizations, and of course, those networks that are well defined if you're in Kaiser or Sutter, some of these other hospital settings, and in your doctor's office. And so that's the backbone. And I want to encourage you not to be misled by these sites as these being the exclusive sites for that distribution network.
All right, Governor, thank you very much.